most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Now we're going to talk again about tool number 5 for fighting back pain, and that's about sitting and sitting correctly, and especially in your car.
Right.
A lot of people have long commutes,
Right.
and they're sitting in their car, and it's really an important time to battle your back pain because it'll make it much worse if, first off, if you are in this position, a rounded C position.
Right.
Brad, do you want to show that?
Sure.
Do you mind if you're in your car seat?
Sometimes it's kind of hard to relate to that spine, but if you're looking at it, we either
here's
have
the head, here's the pelvis.
so the head can just be forward too much because of the tilt, or they relate very much as the lumbar support here to give support in that low back, particularly for those sciatic people.
Yeah, that's how you correct it.
Yep.
This.
So yeah, it is a little bit of a combination using the back support and then how you lean your seat.
Right.
Are you too far from the steering wheel or not? So.
Yeah, we found also if you lean your seat too far back, you tend to, what do you tend to do? You tend to reach for the steering wheel and round your back out. So you're going to want to figure out, what kind of support you need.
Yeah.
And this is a trial and error thing because it's very difficult. Some people have large buttocks, and because of that, they have a big gap behind their back.
The anatomy.
Right.
Right.
So they're going to need like a big support like this.
The other thing that can do it is the shape of the seat.
Right.
If you're have a more of a straight back and you got a hollowed out seat, boy, then you got to get something to fill that in.
There's some car seats that are awful.
Oh man, especially if they're older cars or they've been, but here I put this in there, and you're going to know if you have the right back support because it's going to feel good. It's going to feel like, oh, that's another thing.
My back feels locked in.
Yep, feels good.
But you could do is actually start with a roll towel.
There you
to
go.
Figure out what width you need.
So yeah, just roll it up, put some tape on it, some rubber bands. And, if it feels like there's a bump there and it's pushing into your back and it's not comfortable, it's too big. You need to get something smaller. And, after you play the towel for a while, you realize if you need a bigger one or a smaller one. And once you do that,
then you can possibly order one.
Yeah. And these Botten ones almost always work better than a towel because they're squishy, they're made for it. There is densities on these.
Right.
Some are soft, some are firmer. You have to look at the description.
And they also have a way of attaching to your seat.
Yeah.
Quite often.
Yeah, there's all different varieties.
Here's one that actually is air-filled.
Yep.
And what else do we have, Brad?
Well, we've got that.
Oh, you got yours, which is different.
Right.
Because I think it's because you really don't want to extend too much.
I don't want the lumbar.
Too much.
Right. Because
you want to be straight.
If you've got sciatica, I've got spondylolisthesis, which, not sciatica.
Spinal stenosis.
Spinal stenosis. You probably don't want to have that lumbar bulge, that support here,
So
like
this
these
one
promote.
is good for spinal stenosis.
This one changed my whole life.
And this is good for spondy.
Yeah. Big difference when I changed to this one. I can ride in a car very comfortably. If I go without it, go in my wife's car and I forget to put this in there. As a matter of fact, last weekend I got about 5 miles from home and I realized
I've done that before too.
Turn around to get this because we had a 150-mile drive and I knew I was going to be saying bad words.
We were clear on that, Brad, but you really don't want too much arch. I mean, when you spondy or spinal stenosis, like you reach above and it bothers you.
Yeah, exactly.
So a couple other points, Brad.
And this is memory foam, which to me is very helpful.
Yeah. A couple other points. No matter how well you sit, it's not good for you to be sitting for a long time.
Right.
If you can, you want to take breaks. If you're going on a trip, and at least every half hour, get up, walk around a little bit, go to the bathroom, walk around the pumps. I don't know what you're going to do.
Yeah, it's really, I mean, I've had patients who were taking a 3-hour trip, and I said, just schedule, you're going to stop more than once. You're going to make 2 or 3 stops, get up and go for a little walk, and it'll be helpful. And I
found even, like, if you have a lumbar roll the mechanical one, to actually make it go out and go in. Give your back a little bit of movement.
Right. You mean the built-in one
Yeah,
in the vehicle.
Yeah. But even if you don't, doing a little bit of this, arching and flexing.
Yeah, the point is you can put yourself in perfect posture, but even perfect posture, you still need some motion outside of staying in that for long periods of time.
If you do have back pain or back injury or sciatica, you really want to avoid the long trips if you can.
Yeah.
I mean, it's just not a good time to take a long trip.
You know, it's helpful if you're not driving.
Yes,
and you can tilt your seat back. That's
a very good point.
Much better.
Brad, do you want to talk about the dead
pedal?
The dead pedal.
So, and I never knew this until about 10 years ago or so when my back was giving me a lot of problems. But you got your gas pedal on the right foot, on the left foot, you know, you got your clutch and brake depending. But way over on the left, there's typically a little plastic spot where you can put your foot on, and what that can be used for, I don't know if it's there.
It looks like a pedal almost.
Yeah,
I mean,
but it's just
stationary.
It's part of the frame of the car, and there's a rubber foot pedal there, if you will, but it's not a pedal. You can use that and push your bottom back into the chair.
Right, good position.
Yeah,
right.
And that's, I don't know if that's what it's there for, but it
everybody
works.
will be looking now to see if they have it.
Yeah, see if you got a dead pedal. It's just a little pedal that's motionless.
All right. The other thing, don't have your hands on the steering wheel like this because you're going to bend forward.
Yeah.
Keep them like at a, what position are they? 3 and 9 o'clock.
Yeah. I got a sister-in-law. She drives like this.
Does she really?
Yeah. It's like, boy, I think she's getting better now.
I do the
I was afraid to talk to her. What?
I do the knees.
It's because your legs are too long. Oh, the driving with your knees,
All right, and avoid reaching to the back seat. You're twisting your back, and I know you're always trying to reach back and keep the kids in line.
Back in the old days,
back in the old days.
That anymore.
No, we can't do that anymore.
Back in the 60s.
Right.
When we were kids.
I remember my dad and we had a big van, and he tried to reach back and get out, and he
couldn't reach.
He couldn't reach.
So you just laughed?
Thankfully, yeah.
Under your breath, of course.
All right. Also, do not lift any heavy objects after you've been in the car for a long time, because your discs are going to be pushed out a little bit, and your back's going to be fatigued. So, I mean, it's just not a good time to...
Yeah, not a fatigue from exercise, but a fatigue from...
being flexed.
Yeah, being flexed. And even like Bob said, if you got a lumbar support, you're still stressing your spine if you're in fixed position.
You're a shock absorber, basically, because the car, you know, is going over bumps. And
it's all minor, but over time, it all adds up.
So, all right. Anything else, Brad, you want to mention?
Well, no, but this is kind of, are these going to be the PDF printouts? Yeah, we got some pictures of Bob about 20 years ago. So, you know, if you go
check them out.
Yeah, go on this. You want to tell them how they get to this?
Yeah, go to bobbrad.com, go to the program section, and there'll be a program on back pain. Actually, we have one on sciatica too.
Right.
And as Brad mentioned, there's PDFs you can actually print out, and you'll take it along with you. And
it's going to show pictures of things we talked about. And, of course, Bob did a real nice job of writing out a brief summary, so you can review this anytime you want without looking at us on the video.
Check it out.
Be careful.